Hello, 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 guys. Oh, there we go. So, thank you. Today we have Mer Maylene, a occupation therapist, to help us answer some of our questions regarding to like aging parents. I'm sure a lot of us have aging loved ones, aging parents that we have in our lives, and we might be getting to a point where we need to give them support, give them help. So today we'll have Maylene, a occupation therapist in Canada, to help us ease our little fear and anxiety when we get approached to these stages where we have aging parents, aging loved ones, and we don't know how to support them. Including ourselves, like we age as well. So we're so lucky to have Maylene from Canada, a occupation therapist, to help us with all these inquiries, fears, and anxiety. Thank you. Welcome, Maylene.
Thank you
I,
so much, Ben, for inviting me. I really appreciate it. I'm excited to talk about this topic because, one, it's obviously really important. Um, Secondly, I've been helping people, adults, older adults, along with their families, uh, working with them to help give their loved ones the best quality of life, trying to maintain their safety and independence has always been kind of the number one focus. And then also just number three, like living it. I have parents who are baby boomers and, are still pretty able bodied, but I know that things are changing along with my in laws as well, who are definitely have more ailments than my own parents and helping them through these stages as well. So, but thank you for having me. I appreciate it. And hi
yeah.
to everyone.
So you mentioned that you help existing people with like aging parents or aging loved ones. Like, can you tell us a little bit how you help them on a regular base?
Yeah. So, I work in a rehab hospital. I've actually worked in various areas within the hospital. So I've worked in the inpatient units where this is where people pretty much are staying to get their rehab to improve. And it was in those particular uh, in that particular experience where I was working with people to obviously get their function back. That is definitely a big focus of occupational therapy, is really looking at the meaningful activities of an individual. Often, it's going to start off with the daily activities, which is getting dressed, going to the bathroom, taking a shower, like those very, very basic activities, to more complex activities like grocery shopping, making a meal, cleaning, laundry, those kinds of things. Those are all daily activities, but also meaningful activities, right? Because, you know, each of us, whether old, young, we find meaning in the things that we do on a daily basis, and that we're independent and able to do that on our own. So, of course, when you have some kind of medical condition, disability of some sort because of a medical condition like a stroke, Parkinson's, dementia, those kinds of things, your function changes, right? And and so, the one area was, how do you me as a therapist along with other team members try to get them to their um, regular function as close as possible. And then from that point, because people cannot live in a hospital, they have to move forward and basically, try to get them home, ideally, if that is the best option. So, it's all of that, but it's all individualized, of course, because people may have different challenges. So it's honing in on that particular individual to, get them the right supports, get them the right type of equipment to keep them independent, keep them safe, all of those things. And then the aim is to get people back home. So that's kind of where, where a big part of my career, my focus has been. And, but, I realized that, it's a stressful time for the individual, for the patient when I would take care of the patient, but also the family members. It is extremely, extremely stressful, especially because they don't know the system, especially when they don't know the healthcare system. Um, Navigating that is definitely a challenge. So there's things that, we don't know what we don't know, right? And so I think being able to help people navigate the healthcare system so that they know what resources, what supports that they can get when, if it falls on the caregiver, or the family member, they can't do it all, right? It's hard to do it all, and so being able to find the right supports for that, is also another part of our role, as a healthcare providers, to help you navigate that system and help you find the right answers for what's going to work for you and your family.
That's amazing. So like you mentioned, you touched on a couple of points where you help people with all these aging problems or disease that they get hospitalized, but they soon have to go back to home and adapt to this new life. So how exactly, as like a younger generation or their close ones, how should we kind of adapt at first? Because I mean, like breaking the news to them is hard already, and that happens, I would guess, through a doctor or at a hospital or clinic. But afterwards, right? Like, how do we kind of remind them, hey, you have this new condition, like how can I help you? Or instead of like, hey, let me do it, or don't, get in all these like angry like situation where like they don't feel good, but like you as a supporter, you want to support the aging people, but like how do we say it in a like right way to like, hey, let me help you, or you'll fall, or you break your hip again. Like how do we say it in a way where like I would say that would be a first step before even we get to touch it, like, or even assist them, right? Like how can we say it in a way where it doesn't offend them, or how do you usually tell like families to approach this kind of problem?
Yeah, you know, it's interesting because I think, as family caregivers, I think we think the answer is to just tell them, hey, this is what you should do, and start telling them what they should or shouldn't do. And I truly believe that isn't actually the first and best approach. I think it is actually hearing them out and actually talking to them and having a conversation. I think a lot of times what I see a lot of is a lot of resistance, a lot of not accepting the suggestions and recommendations from, whether it's a healthcare provider or even family members, right? Sometimes I actually find that when your loved one, your aging parents or whatnot, hear it from a family member, it is so much harder to hear, right? It's so
Mm.
much harder to take that advice from someone who's close to you and definitely cares for you, right? But what I would say is, you know actually, just, it's the acceptance piece. It's the acceptance that if they are currently going through something that is an ailment and they are actually having trouble, and starting to have difficulties, this is what you want to start noticing, right? And maybe starting to have the conversation about, like, how is that going for you? Like, are you having trouble with that? And just listening to them first, and just understanding them. A lot of times I find individuals want to just be heard, right? And it's in that piece of just being heard and being understood, do they start letting those barriers down and start appreciating what's happening to them, and having them, having them talk it out, and coming to a place of acceptance. Because without the acceptance piece, that they know that, okay, yes, there's things that I need help with, it's going to be hard to convince them to do something if they're not ready.
Right.
So there has to be a kind of readiness. So with that, all that to say, keep in mind that it is a process, right? It's not going to be an overnight thing. It's not going to be like, hey, I noticed that, hey, you should just use a cane or a walker right now. It's
Right.
not that easy, actually. It is actually, I think you have to consider time, right? You have to consider time, for them to process the information. And it might take a really long time. It might take a really long time.
So hear them out and really just like see where they're at and kind of meet them instead of like, hey, ask them, hey, just let me do it kind of deal.
Yeah.
So once we kind of let that time and like caring and hearing them out, where would you say are the best next step would be to move on with caring with aging loved ones that is around our household, or we kind of have to bring them into our life now that they are aging and incapable of just being on their own?
Um, I think one thing to consider is, maybe just even starting to look around their home, maybe trying to um, make it sort of safety proof, right? And looking into areas that can be high risk, especially again if you're starting to notice changes with your parents. So one thing to look at is their physical changes. Are they looking weaker? Are they feeling weaker? Are they getting tired very easily? Or cognitive changes, they're thinking, like, are they starting to forget things? Are they, and definitely I would say, especially if they're forgetting things, I find um, people might get really defensive, right? When you're like, oh, I think you forgot that. No, I didn't, right? They might just kind of respond like that. So again, being really compassionate and being very gentle around how you communicate as well, right? I mean, think about yourself. If someone were to just tell you what to do, are you going to be like, sure, I'll just do exactly what you, no, right? It is in the way of how you communicate, I think is another key part of it. But going back to, kind of foolproofing maybe their environment, their home, and looking at high risk areas that could be potential areas for falling, which is a big source of people going into the hospital system. And not sometimes it's just a trip, maybe not because they have any mobility issues yet, but you know what, like they might have just not paid attention to something. But of course, once someone is older, the recovery process is also going to be a lot more challenging, right? Or it won't, the healing may not happen as quickly, especially if they're not really healthy to begin with. So I think, finding areas within the home that could be high risk, that could be the bathtub area, shower area, considering those areas, maybe grab bars to be able to hold onto in bathrooms. One recommendation we typically will give as a OT is, if people need to sit on something because their balance is off, being able to sit in a chair in a tub and having one of those removable shower heads so that they don't have to get up, under the shower and stand in the shower, and you just kind of hose yourself with the shower head. That's kind of a very typical recommendation in a bathroom. Non-slip mats in a bathtub. Any tripping hazards, carpets, things like that. Clutter in the home, keeping your space, your area open for that. So those are just a few things that, off the top of my head that you can start looking into, right? And then even just their actual activities, right? Like a lot of times it's not going to be their personal activities, like getting dressed, going to the bathroom. They'll still be able to do that, generally pretty well. But it's in their like grocery shopping. Are they able to mow the lawn? Are they able to kind of drive? Like those are very high level function type of activities that you might want to notice. And you know what? I guess part of your question, I'm assuming, is like, so how else can we help?
Yeah.
It is helping them do the groceries, maybe just visiting them and doing a load of laundry for them, and trying to fit that in your own schedule, because you also have a life to live. You're working, you might have your own family members, you know whoever else you might be caring for, and so there really is, caregiver burden is a real thing, right? And so finding a way to balance that, and so if you kind of get ahead of the game and prepare yourself as well as your your parents as well, and having the conversations early, then they will hopefully start to get the big picture, right? Yeah. And yes, I see having a ton of patience, 100%, right? I think it's, children and parents can definitely easily clash, right? And And here's what I will say. The one thing that um, I, whenever I work with my clients, my patients, it is, it is actually respecting their choices. So long as they know what the risks and benefits of things may be, right? And it's hard as a family member when your loved ones may not make the choice that you think is best for them, but in the moment you do have to respect it and understand it, and it's that compassion piece, right? And saying like, okay, where is that coming from, and really trying to understand them. And I think if you just start there, um, I think that will hopefully put you at ease and being like, all right, I think I know where they're coming from, and trying to really be in their shoes as well. So yeah.
So you mentioned like if they are getting forgetful or some like just memory problems, but at the same time we want to kind of respect them and like honor their choices. So let's say if they choose not to take certain meds or they forget or they're just so off on their timing. So in that case would we still like kind of just like okay, let them be, or like what would you suggest in terms of balancing the um two problems we have in front.
Yeah, no, that's actually a good one. That's a big one, right? I mean, the medications. And I think this is where you want to either get somebody to assess your loved ones if there's a cognitive challenge, right? A cognitive impairment, because then are they making a sound decision, right? Then are they appreciating what it means to not take medications, right? And so, you know, can they appreciate that if they don't take the medications, that um, there's a consequence to that, and what is that consequence? So have that conversation and almost ask them versus telling them. I mean, like, if you don't take this medication, then this is going to happen to you. Yeah, they probably know that,
Yeah.
or they don't, right? And so I think it may also just be a repetition. You might just have to keep at it, like persevere and just keep at it, but in a compassionate way, with lots of patience, absolutely. And and definitely, um, again, you might need another assessment for some reason, if it's a cognitive difficulty, right? If it's a cognitive challenge that they don't appreciate why they need to take the medications. And sometimes people understand what the risk is and they're like, well, I'm okay with that, I'm okay. And then you then really just come from a place of understanding and trying to respect. But it is a fine balance. Medication is a tough one, I think, because we know that there's a consequence to that if they don't take it.
So other than medication, so what kind of other habits would you suggest for maybe the caregivers or even the aging people to adapt of these new habits to get into this new world of, aging parents or taking care of an aging person? Like, is there any habits that you would kind of suggest them to incorporate now, and then slowly this habit will kind of build onto what they're coming at them, I guess,
Are you talking about the caregiver or the actual aging parent?
A little bit of both, I guess, in the household, where like when they get sent home or they're at home, like what kind of habits can we adapt where we're prepping for the future, or as a caregiver, and what can the aging, like what can we teach this aging parent or loved one to practice, like what are some habits where we can kind of just start now and
Yeah,
apply.
yeah. I mean, I think if you're taking the proactive and preventative approach, then you definitely, I think, healthy, just overall healthy habits. So staying active, right? Because as you age, um, definitely when you're not active or mobile at an older age, you will lose that function much quicker, right? So even thinking about maintaining your level of function, right? I mean, ideally, it's always great to try to improve your function through your diet, through your through activity, like being active, even like socializing, right? Like that. There's a emotional mental health component to your health, right? Like it's so holistic, right? And so you know, keeping those in mind, how can you as the caregiver help support that? Because if, for example, your parents might be a little bit more isolated in the home because they have mobility issues or other health issues, but they really want to socialize, or kind of it's a good thing for them and maybe they're open to it, but they just can't get there on their own. Maybe it's like supporting them and bringing them, to an event, to a social community event, once that week or something, right? And maybe um, like I think I'm going back to like the other healthy habits of like being active,
Right.
um, just getting them moving, getting them stimulated, cognitively stimulated, whatever that could be a crossword, for example, but finding something that is actually meaningful for them, right?
Right.
Because if you're just throwing stuff at them that you're like, well, I think you'd like this, and then they are not even interested at all, then it's going to be hard to motivate them to take action on it, right?
Definitely. So really just stay active in physical and mentally
Yes.
so that they are keeping them active in both ways so that it won't break.
I hope, yeah, exactly. I see something. Can they operate the drivable grocery cart? I care for my mom. She's 89 next month, cannot drive the cart. Oh, okay. Um, and I guess, is that a question that can they operate a drivable? Like, are you wondering if that's what you do to check to see if they can do it or not? And there's so many functions, right? When you're having to operate a grocery cart, like if you think about what it requires to drive, you need the attention, you need the response, the reaction time to be able to react if somebody's in your way. You need the physical ability to actually grip and hold on to the cart and turn it. You need to be able to get out of the cart, grab your stuff, put it in the cart. There's a lot
We
involved, actually.
don't think about that all the time, I guess.
Yeah,
There's actually that much,
exactly.
hey?
There's so much that like, and I think that's what we do as OTs is really break down an activity or a task, and we're like, well, this is what you need to be this is the function you need to be able to do this and this, or this one task. You can break it down into so many different steps, and that's why when an OT will assess somebody, we're assessing their physical abilities, we're assessing their cognitive abilities, even their emotion, even their emotional mental state. Like, where are they at? If they're depressed, no one's going to want to do anything, right? They're not going to be motivated to engage in anything, right? So it is such a holistic approach in how we look at somebody before we even say this is what's right for you, right? However, you can do some of that again just by you might know your parents so much more, so much better than maybe a therapist in that moment, and you're like, their nuances, their little habits and behaviors that a healthcare provider may not know, right? And so you have that insight. So understanding that could be really helpful to deciding like how you can support them better.
That's amazing. Like even a simple task of like driving a grocery cart takes so many small little mobility, cognitive, and everything that like I guess normal human we're not even aware that it takes that much. And you mentioned that a OT, a occupation therapist, actually goes through a assessment for simple skills like this, like pushing a grocery cart or even like opening a kitchen cupboard, I would say, or even like having washing their own hair or even just going to number one and number two on the toilet can be a simple task, just like pushing a grocery cart, right? So where can everyone find you, and like what kind of assessment can they have on aging loved ones, so that we know what they're capable of doing, like pushing a grocery cart or maybe washing their own hair, like. So is this assessment that we can get through you, or what should everyone that's watching this replay can do so that the aging loved ones around them know exactly what can or cannot do even simple tasks as pushing a cart, opening a kitchen cover, or going to the toilet, or washing their own hair.
Yeah. Yeah, no, thanks for asking that. Uh, I am registered and licensed in the province of Ontario in Canada. So that's where me particularly can do assessments and treatments in that province. That's where I'm licensed. So if you're not in that area, definitely seek out an occupational therapist in your hometown or area, because there's many out there. And to get that exact assessment, and treatment ideas, or some suggestions on therapy and things like that. However, from a consult basis, if you're just like wanting to understand other ways to just support your parents, and getting a little bit of guidance, I'm definitely reachable for sure. You can for sure find me on Instagram at OT Perspective. So come follow me there. I give some tips as well, just with aging parents, and other insights. But yeah, I think finding yourself an OT to do those direct assessments. But I also can offer just a home safety checklist, if you just want to use that to check out, go through the list and see within the home if all things are kind of checked off, and things to consider, things that you may not have even realized that you would need to look at and consider.
That's awesome. So where can we get this checklist? Like,
Yeah, if you actually email me at Maylene at ot-perspective.com, then I can definitely shoot you a link to this checklist.
amazing. Thank you, Maylene, for your time today. That helping our loved ones, our parents aging, and like just small tips like listening them up, honoring their decisions, really keeping them physical and mentally active, and simple tasks as pushing a cart or opening a kitchen drawer can or cannot be something that might challenge them. So we should get that checklist and just tick off those simple tasks, and even like age proof our home so that there's no injury or falls in the future that can cause more damage and long-term care. Thank you, Maylene, for your time. And people, for everyone who needs more support and help, go follow her right there, or right there. I'm not sure where the screen is, but it should be right there. Thank you for your time again, Maylene. Thank you. Appreciate it.
Joined, and yeah, I appreciate you very much, Ben, and all of you are in such good hands with Ben. So
Thank you.
thank you so much. Have a good night, everybody.
Thank you.